Hello and welcome back to the Out of Program podcast. Today we're joined by Dr. Lucy Marples, who is a practicing doctor with a long career in the world of health tech, having worked at some of the biggest health tech brands, including Babylon, Accurx, Google, and Zoe. She's also an advisor for Byte Labs, UCL Global School for Business, and Zinc. Welcome to the show, Lucy.
Thank you for having me. Nice to be here.
So we start the show, as we always do, which is to ask, what got you into medicine?
Sure. So I got into medicine pretty late in life. I didn't graduate medical school till I was 32. So I was about a decade behind my medical school peers. Briefly, I'd studied philosophy and English at university. I'd really enjoyed it. I'd been lucky to teach a first year seminar group in my final year and thought, this is it. I'm going to be an academic. I'm going to teach. Love it. So I did an MPhil in sort of quite dry philosophical logic, thinking that was the quickest route to a PhD and the quickest route to academia. And I really loved that year, but did find it quite sort of navel gazing and kept thinking during that year, even if I sort of solve this theorem or whatever, no one cares. It felt a little bit navel gazing and a little bit detached from the real world. And I'd always sort of volunteered and worked in mainly sort of mental health charities. So I had a strong interest in the real world. And so it just felt a little bit too detached. So I had to slightly kind of rethink my career. So I was therefore looking for roles that were kind of intellectually stimulating, but also trying to tackle some sort of real world problems. So I then moved into various sort of public policy charity-esque roles without any real sense of direction. And I had some really fantastic experiences. I was quite lucky. I was often in the right place at the right time. But it meant that increasingly, just by sort of chance, I was working on health policy. It's a really interesting time to be working on health policy, and increasingly getting a lot of exposure to clinicians and people like that. And after a few years, I sort of thought, oh, do you know what? Actually, I've never considered it before, but being a doctor does seem to meet all the things I'm looking for in my career. It's sort of intellectually stimulating, it's lifelong learning, it's something that no one can argue is a valuable thing to be doing. It feels somehow sort of important and useful, has a lot of variety. And also there's a real human aspect there, which I've always enjoyed. So you're dealing with people in quite, vulnerable points in their life. So it just seemed to tick all the boxes. So age 27, I applied for medical schools. I had to go back and do all of my science A-levels, which was particularly fun. Yeah, and so that's where I ended up.
I mean, that's really interesting because you started off by doing a humanities degree. You got into policy. You were well on your way in terms of your career. And then you basically made a hard right turn into something, I know that there was some relatability in the health policy, but clinical practice is very different. And you had to go back and do your A-level, start essentially from, ground zero in some ways, to even be able to have a chance at studying medicine. Was that quite daunting for you?
Probably, I think that's just a bit cocky. Honestly, I've just always sort of thought life is long and you're going to be working for, 50 years. So it didn't feel, I know some of my friends at the time said, oh, that's a big choice, but it didn't feel like a massive choice. Well, it didn't feel too daunting at the time. I think it was a good lesson in hubris because certainly with my A-levels, I thought, oh, how hard can that be at time? It's quite hard, even if you've already got like a master's and so on. So it, and certainly with the medical degree as well, just the sort of sheer volume of learning, it was very different to an arts degree. It's often very hard to get the very high marks, but it's not as hard to kind of pass just by being smart. Whereas the main thing I learned in medical school was that the people who get the high marks are the ones who are in the library on a Friday night rote learning and shortcut to that. So as I said, it was a real lesson in hubris going through the process, but I actually did enjoy it and I did enjoy the learning as well.
That's really, really interesting. And then how did having done all of this work in policy and having built a career there, was there any sunk cost feeling when you were making that decision? Or was it very much that you were convinced that this was the right path?
I think a bit of both. There was definitely a sense of I'm behind my peers in medicine, sort of what was the point of that bit. But at the same time, like I said, I also thought if I'm going to be a doctor, I'm probably going to be a doctor for the next 40 years. So being a consultant age 35 instead of 30 or whatever, obviously I haven't got, but that it sort of felt a bit much for muchness in some ways as well. I thought as long as you're on a ladder you want to be on, it doesn't really matter how long it takes you to get there.
So you get to med school.
Yeah.
Did you feel like you had a different perspective from the other students, having come from a humanities background and also having worked for several years?
I think I found it a lot harder. I did the grad course at King's, and I don't think they let art students on anymore. But how they do the course is the first 2 years are done in 1 year, and there's no like concession to that fact. You literally just the lecture theatre as the first year's file out and the second year's file in. So I remember just sort of and most of my peers had sort of biomedical science degrees. So I just felt lost for a lot of it. I was just sort of sitting there Googling what is a protein and things. So it was hard and often frustrating for that reason. I think the main difference in perspective has probably more coming less being older or having a career, more coming from an arts degree where, like I said, in medical school, you are all doing the same exams. There is one answer to that question. There's not much room for personality or individuality, understandably. Whereas with a sort of an arts degree, it's all about what you think about this thing or what is your perspective on the matter. So sometimes I found that satisfying because you could just sort of tick through the work. In other ways, I found it a bit frustrating because it just felt like we were all sort of like carbon cookie cutters, whatever, of each other. But yeah, I also, it was only 4 years. It was a lot of work, so I just sort of found and got through it. Yeah.
I mean, it must have been incredibly tough, starting with an accelerated degree, especially with the steep learning curve when it comes to the science. At any point, did you, question your decision, regret your choices?
No, like I said, I found it hard, and I was a bit overwhelmed with the volume of learning. But at the same time, it's a finite task that you just have to sit there and do. It's a bit like, I remember thinking it was a bit like if every leaf on a tree had a different name, and you just had to like sit there and learn it. Like you could, it felt so overwhelming, but at the same time, it was you could see the whole tree. You just had to start at the beginning. So. No, I didn't question any choices at that point.
And having come with a completely different perspective to your typical medical student, did you pursue any opportunities off the beaten track while you were a student? Because you tend to find that people who come in from a diverse background also view their medical training, view medicine very differently.
I think I just didn't have time. I just had to work, I think, a lot harder than other people just to get up to zero. So I didn't really have much capacity during medical school. I was quite the kind of extra things I did do, I was quite strategic about because I didn't want to leave London. And this, I think the way that clinical placements has changed now, but it used to be you were ranked against everyone in the country. And if you were high on the list, you got your first choice of placement. And I wanted to be in London because my life was there, my friends were there. I wasn't going to be moving to somewhere random in my 30s. So I was working towards a London post or an academic foundation post, which is what I ended up doing, just so I could stay in London, really. So I was quite strategic in terms of the things I did do. Sort of I did some things like some publications and some other extracurricular things because I knew I was like ticking off the points on the application form, but I didn't really have capacity because I was working hard for other stuff. But certainly in my foundation training, I loved that because suddenly I had way more time. I got time to explore things that just seemed a bit interesting. I got involved in sort of, in quality improvement initiatives that seemed interesting. Also, I had time to pick up again the things that I'd kind of been doing throughout. I'd always done things like I was a sort of trustee at Mind, and I facilitated workshops for a regular philosophy seminar for socially isolated adults and helped set up a bike recycling thing. So I had like fingers in a few different pies. But they were mainly just things because I enjoyed them or they seemed interesting. There wasn't much of a sort of I'm getting into health tech plan at that point, certainly no.
How do you feel about clinical practice when you got there? Was it everything that you imagined or was there disillusionment? Talk me through that.
Yeah, I had different placements in different hospitals, and some of them I loved. This is fantastic. And some of them I really hated. And I think probably the things that I loved and hated will be very similar to what most doctors like and hate. So I think I really liked the feeling I was doing something real. I really liked interacting with people. I really liked the pace of learning. I found that really exciting. I think the things that I found frustrating were generally the sort of the systemic stuff, the fact that the rota coordinator ignored your emails, or you couldn't get that one weekend off of the year you needed to, or you had no locker. Those kinds of things I found quite hard, more so than any of the clinical side, like the death or the night shifts or anything. But overall, it was a very positive experience. I think I wouldn't say there was disillusionment, but I definitely found myself looking at in each placement, looking at the consultants and thinking, is that what I want to be for the next 40 years? And always feeling sort of, well, not really. I don't think I'm quite you, or I don't think I'm quite you. So it wasn't disillusionment so much of a sense of like, I haven't really found my thing yet.
And of course, we'll spend a bit of time talking about your journey into health tech. But before I ask those questions, I'm curious to know if you thought about going back into health policy after, having had the original career and having had some clinical practice under your belt. Did you ever think to combine the two once again?
Not really, honestly, no. I mean, I've looked at roles that have been in sort of policy adjacent. In some ways, it feels like a slightly artificial distinction. The roles that I'm interested in are ones that are to do with health and to do with making things better or innovating in some way, trying something new. And that could be policy, that could be tech. It doesn't really matter. So yes and no, but I don't think I'm looking for sort of health tech roles or health policy roles. I'm just thinking, is that interesting? Is that a smart team? Is that a nice problem to solve? Yeah.
So let's explore that a bit more then. Where we're up to is that you've started your clinical practice and you've started observing those around you and thinking, actually, maybe that's not the life that I want. Talk me through how you started thinking about exploring different things, especially into that journey into health tech.
Sure. So I took a year out in between tranches of training when a lot of people take a year out. So it didn't feel particularly controversial to do so. And I think at a time where a lot of people would go to Australia and make lots of money or do whatever, I was sort of thinking, well, I haven't found my thing yet. Why don't I just explore other health adjacent roles to do with, as I said, improving problem solving? But it felt like quite a sort of safe way to explore, because I wasn't yet officially stepping out of training in the long sense. And health tech seemed like an interesting area. It was very sort of burgeoning at the time. There weren't many clinicians working in it. It was a good way to sort of bridge my bit of clinical experience that I did have. And a job popped up at Babylon Health, which was a digital and clinical AI fellowship, and it was billed as a year-long post, which was sort of supposed to be a bit of I remember it being described as a bit of a master's in sort of health tech and AI, working on the side. And so without any real deep long-term 5-year plan in mind, well, that sounds interesting. Yes, I'll be able to learn about this new sector that I don't yet know much about. It seems like an interesting thing to do. I'll be able to learn whilst doing. So it was a kind of quite an easy choice to say yes and take on that role.
I guess it's really interesting that it was billed as like a fellowship, because it meant that, for many clinicians, the concept of a fellowship is well understood, where you get that exposure in a particularly niche or specialized area. And it sounded like they were trying to bridge the gap between clinicians and also the business world. So was that introduction quite gentle for you then, in terms of moving into, I guess, a more kind of business role for the first time?
Yeah, I think it didn't. I'd worked before medical school. I worked in sort of private sector organisations, so sort of brand strategy companies and things. So it didn't feel particularly shocking, any of it. It was all just kind of quite like, okay, yes, this is a good thing to be doing. Yeah.
And then you spent your time in Babylon, and then you moved on to a number of quite illustrious organizations like Accurx, Google, and Zoe. How did those kind of come about? And, how did you find your time in those organizations?
Yeah, I think I was often very lucky in terms of being in, as I said, in the right place at the right time. So Accurx, I actually had heard of them. They sounded really interesting, and I contacted the CEO directly. And just wrote a very enthusiastic letter and to coincide with them thinking about expanding their clinical team. And I was really lucky to be there at a time of real growth. So I joined, it was a very, very small team when I joined. It was January 2020, so just before the pandemic hit. And they were still, I think they'd been running a couple of years, but they were still slightly, I don't want to do them disservice by saying they were still slightly finding their feet, but they were still slightly working out where to go next. So it was a great time to be there in terms of a a period of extreme company growth, extreme adoption of their technology. So the first thing that I worked on pretty much was video calling for primary care. And they built it over a weekend, and within 5 or 6 weeks, something like 45% of GPs had using Accurx had turned into 98% of GPs. So it was insane growth. It was amazing. And it was a period of like very hard work, but work that felt really important, a mission that felt important, because it was a very fast turnover as well. There was always something to be doing. There was always kind of the next important thing to be working on. Like we sort of built a vaccine booking product as well. And because it was initially a very small team, I was able to sit across a lot of different teams in a lot of different roles. So it was a fantastic experience in terms of getting a real understanding of how to build products in a good way. And I really look back on that experience and think like that is a good mental model and gold standard of what product development looks like. But I got to get my hands really dirty with every aspect, from coming up with ideas to doing user research to sort of helping with designs and implementing pilots and rolling things out and so on. So yeah, so it was lucky time.
And what's striking about both your, what you've described about Babylon and Accurx is that you came upon them quite early on. And of course, when you go to these organizations early on, I don't think it does them a disservice to say that they were maybe a bit chaotic. I mean, certainly as the founder of Patchwork, the first couple of years were unbelievably chaotic because you don't know what you don't know. And of course, you're experimenting with a lot of different things. You are agile, so you can try many different things. But then, of course, it's basically organizing chaos. So it sounds like you got a good dose of that during your time at both organizations.
Definitely. And it's like I said, it's nice to be able to try lots of different things, but it's also help shape some of what good looks like and future ways of working and future practices. And it's also just quite useful realizing, coming from something like the NHS where there is a way of doing something, and that's been the way for 50 years. It's realizing that actually a lot of people don't know what they're doing, and that's okay. And we're all just having our best go and then quickly learning and quickly changing if it doesn't work. I think it's quite a useful lesson for clinicians in terms of you don't have to get everything perfect or do things by the book because maybe no one's written the book yet.
And I think what I really like about your story about Accurx is that over a weekend, they developed the solution, and then, within a short space of time, it was already in 45% of all GP practices. You compare... Oh,
right. It went from... it was insane.
Yeah, that they'll be writing stories about that in business schools, about health tech growth playbooks. But how did you then compare that to your clinical practice? So the reason I ask that is a lot of clinicians talk about, moving into health tech because of the potential for high impact. And your story there is probably as high impact as it comes for anyone moving into a health tech role. I suppose I wonder, because to my understanding, you were still practicing at the time. How did that compare when you are going into, a hospital environment, going into clinical practice where it's far more rigid and, dare I say, bureaucratic, versus then the lightning in a bottle that was Accurx at the time? How did you view that that contrast?
Yeah, so the main period I was at Accurx was a lot of COVID, to be honest. And so in some ways, I understand the question that you're asking, but in some ways it was a little bit mad for quite a long time. I was working in A&E, but also mainly in A&E, but also on the wards. It felt like every shift I did, it had moved from being we're swabbing one person in a hazmat suit in a car park to, people are dying in A&E, to where do we put all of these bodies? It was like it slightly felt like the world was on fire at times. So in some ways, during that particular period, there wasn't that sort of slow, steady, clunky pace of hospital life. Oh, yeah. But I understand what you're saying. I think personally, it's always been really nice to have a foot in both a clinical and a non-clinical world, because it allows me to go into clinical shifts without having done 7 days a week and being really burnt out and tired, but also to see the genuine value of what I'm doing, and it feels kind of important. It also makes me value the non-clinical side of things, that we can be creative, and that no one's dying at the end of this. It gives you a bit of a sense of, a bit of a tip, I guess.
totally understand your answer there. And I guess, I guess it's hard to answer from your side because those were, interesting times as it were. Those were that was a very unique situation. But I also get it as well because I remember in the early years of patchwork, I was working as I founded it during my foundation year training. But when I was working as in the emergency department, people would ask me like, wow, you're working ED where the hours are very unpredictable and very antisocial. Like, how are you balancing this with, also starting up? And I used to tell people that I actually found that the two experiences fed into each other. I found that my experience in the hospital was far more rewarding because I was looking at it through a very different lens, because you're also thinking then about the technology that you're building and how you can make an impact. And the beauty of being in emergency medicine as well is because there are so many 0 days and because you're working the unsocial hours, it means that the social hours, the working day, can actually be applied to the ideas that you may have and your startup. So actually, it was very synergistic.
Like a nice example of that. I agree. I had the same experience. A nice example of that is I think the week after we launched the video calling, I used it in a ward to allow a patient to say goodbye to his family members because they weren't allowed to visit. And they all, you could tell it was a very moving and useful thing for them all. And it also, I remember at the end that when it was first launched, the product, he used to have a kind of goodbye message at the end was, hooray, your call's over. And I remember coming to the office on the Monday saying, okay, we need to get rid of that because that doesn't necessarily fit with the clinical scenario which someone's just used this. They might have been getting bad news or doing something. So yeah, I definitely agree with it. It was this quite sort of synergistic thing where I was looking at each role from the other role's eyes, which was really useful.
And then from Babylon and Accurx, you went to Google. How was that experience? Because of course, Google is not an early stage startup. It is a tech titan. Did you find that different, or was there actually a lot of parallels in what you were doing in your previous roles?
Yeah. So the main reason I was basically looking at that point I really enjoyed the sort of startup world. I really enjoyed the kind of no one knows what they're doing and we're all being scrappy. But I was thinking it would be good to get at least a couple of years of experience of here is a big structured organization that has a playbook. So I was looking at companies like Google, which is why I went there. And actually, interestingly, Google is probably less of that than you might think from the outside. It is quite a flat hierarchy. People have a lot of autonomy to do what they want. They're often trying new things. So in some ways, it does feel a bit more like a giant, messy startup than you might expect. So I don't think I necessarily got that kind of thing I was looking for. But in terms of the work itself, it was fantastic. I was working in the health team in a sort of small. It was effectively a bit of like an internal consultancy type service to support any health related work across all of Google's products and platforms. So it was great working with really, really smart people, having autonomy to try new things, but feeling like the work had a real world impact. You could change something small and then that thing might have an impact on, say, something that's been viewed billions of times on YouTube or the way that people use search. So it did feel, again, it was nice to have that sense of you're doing something that in some way has a tangible impact and has improved something. So yeah, so I really enjoyed it.
And so far we've talked about many of the operational roles that you've had in the world of health tech. More recently, you've now transitioned into taking on advisory roles. And I think that's really interesting because, many of the audience will also be looking at opportunities for themselves and wondering, how do I take on these additional roles to basically flesh out and round out my provide more intellectual interest. So I guess could you speak to that and talk a bit more about what those advisory roles look like and how you stumbled upon them?
Sure. So it's all been quite sort of organic. I think when I moved into health tech about 6-7 years ago, there weren't that many clinicians out there. So it's whereas now it feels like it's a much bigger pool. But it did mean for a long time there didn't feel like that many people. You all just sort of knew each other and you all sort of helped each other, and that was really nice. So a lot of this has come back very organically, just from sort of warm introductions or knowing people or whatever. I think in terms of a lot of the advisory work I do is pro bono. just because I actually really enjoy it. It's quite nice. It's quite interesting. I like meeting new people. I like hearing about interesting ideas. I think there are lots of opportunities out there, increasingly so for clinicians. I think my only advice would be to kind of be thinking about how you're pitching yourself in terms of what is the thing that you're going to be advising on. So I have probably a stronger sort of producty, opsy type experience than others. So I would go in and talk about how you might want to develop an idea or test it and so on. But I'm not a cardiologist. I'm not someone who's going to be going in and giving like deep clinical insights, because that's not my area of knowledge. So I think if you are a clinician looking to get into those kind of roles, that would be my advice, to be think about like what is wherever you are in your training, wherever you are in your sort of skill set, that it is all very useful. Even let's say if you're a F1 and you've got 6 months of clinical work under your belt, so you're not particularly senior in your career, you're not particularly senior clinically, you've still got really interesting insights into how a ward works. How do people actually do things? Like, what are sort of healthcare professionals' mental models? How really useful insights like, oh, actually, probably there's no sort of Wi-Fi or phone service in the hospital is useful to someone thinking about developing a mobile app, for example. So yeah, so go out and look into these companies. Always looking for people. You will always have something like helpful and sensible to say, and just sort of pitching it at the level of experience that you have. Yeah.
And how much of that was strategic and how much of that was serendipitous? So what I mean is that, it sounded like you picked up these roles in a time when there were very few people, quite frankly, less competition. How much of that was actually you zoned in on organizations that you really liked and wanted to work with, as opposed to just kind of stumbling upon it because you have such a great background and fantastic network?
Honestly, a bit of, I'm not one of these, I don't have a defined 5-year plan, and I'm not ticking through my sort of mental checklist of what I need to be. And I feel like I've been really lucky. It's often been a bit of a right place, a bit of a right time. I'd say a lot of the roles I've had have ultimately been not because I've applied for them, but because I've been asked to apply for them, or applied for a different role at that company and not got it. And then they said, what about this? Or just because it's come out of a sort of organic coffee conversation. So a lot of it's been quite organic and lucky. And whilst I don't have a sort of defined 5-year plan, I think I usually have the next step in mind, or the kind of vague direction in mind. And I'm usually thinking about what I need from a role, or what might be the next steps to get me to that next step, even if that next step then changes. So I've definitely turned down roles that sound really fun or interesting or sort of lucrative, or I've taken roles that sound potentially less fun, interesting, lucrative, because I thought that's an area that I don't know much about, that I'd like to kind of build up and kind of pad out a bit in terms of experience. And that will set me up for maybe the next thing, which is the thing I want to do. So, yeah.
So just to explore that a bit further, because the question that I had in my mind was, how do you decide what is worth pursuing versus what is worth parking? Because you have the advisor roles that we've talked about now. You still hold operational roles as well, and you're still in clinical practice. That is a lot to be juggling. So what's your mental model there?
Well, I don't think I have a good answer to this, to be honest. I think I've generally been quite lucky that I have been able to pursue the things that I want to pursue. I think it's only in the last couple of years, when I've got a young family, that the demands of all of my roles have become a bit more, that I've had to start being a bit more decisive and strategic and deciding what not to pursue, as you say. I think the only real mental model I've got is to, I guess, to try to often take the decisions that leave more doors open, that often feel sort of bigger and more expansive. And because of the nature of the sector that I'm working in, which is changing very fast with developments in AI and in data sharing abilities and so on, it often feels like I can have a sense of like, oh, that's an area that I think is going to grow, and there's lots of kind of exciting unknowns there. So that's where I'm going to be moving towards. I honestly don't have a fantastic answer. I do think that life is really long, and you're going to be working for a very long time. And every experience you have or have taught you something and be useful in some way, even if it's sometimes like, well, I don't want to do that. That's useful to know. So I think just kind of being a bit open-minded and being curious and being positive and having a vague sense of where you might want to go next, and a vague sense of the practical things you need to do to get there. Yeah, sort of that's what set me up so far.
I think your point about life being very long is a really great philosophy to have, because I used to think to myself that I wasn't achieving enough at any stage of my career, even though, I didn't have a completely separate career before then coming into medicine. I was pretty standard. And even then I was thinking, yeah, I always wanted to do something in technology, to do things in startup, but it can sometimes be a bit unhealthy doing that comparison. So I was a graduate of Imperial, and, many people looked up to Lord Aridazi, for example. And if you know anything about Lord Aridazi, well, he has, roles in policy, in technology, in clinical practice. He's a surgeon, he's a professor, he's all these different things. Any one pillar would be enough to satisfy a person in their career, and yet he had it all. So on the one hand, you compare to, people like that, exemplaries in the field of medicine. And then on the other hand, you are fed all this information about, startups and startup founders. And you see Mark Zuckerberg, dropping out of school, and creating $1 billion business at the age of 21. So I remember feeling a lot of that anxiety. And I think what's interesting about your story is that you didn't allow that sunken cost feeling to impact you, but you accelerated in your career. Well, you can tell me that, but it seems like, where you are today, you've had quite an illustrious career, and you're in a really enviable position that many clinicians may look at, even though you started that journey in medicine much later because of your first career.
Yes and no. I think my career history is a nice example of you can leave and you can do different things, and it doesn't always have to take that long to sort of, as you say, build up like a good CV. But on the flip side, I definitely still compare myself to my medical peers who are now sort of on the cusp of consultancy, and think, oh, I'm still quite junior clinically. So I think that there is always going to be some feeling of comparing yourself to others. That's just normal. And you have to slightly accept that you can't do everything to 100%. You can't be, if you want to be kind of the person who discovers this, I don't know, particular interesting breakthrough in science, you probably have to spend a good 20 years grunt working through lab work to get there. That's your choice. But or you could you just have to slightly let go of that comparison, because there'll always be someone who's done it better and faster and to a higher level than you. But I think it's about maybe like redefining how you think of success, and working out what are the things that are important to you to feel positive about what you're doing. Yeah.
And on that comparison with your clinical peers, do you still hold an aspiration to become a consultant?
Good question. So I'm still kind of working I'm still working up the A&E clinical ladder. I don't particularly want to be a consultant, but I would like to be a certain level of clinician that I'd be happy with. So I'd be happy with a sort of senior registrar level. I want to be able to, there are certain things I want to be able to do clinically. But no, that I think the admin side of things that come with consultancy doesn't particularly appeal to me. So I would like to be able to work out that balance, that clinical, non-clinical balance, and still continue to do both to a good level is my ultimate aim.
And I suppose in that career journey that you've achieved a lot. Did you have any mentors along the way that kind of helped you?
You know what? No, and I really like some. I think that's something I would have found super valuable, particularly because a lot of the decisions I've made have felt slightly like punching in the dark, or just having a go when there isn't an obvious career path stretching ahead. I'm lucky to have some incredibly wise and kind friends and colleagues who've been really happy to spend time talking to me. I would love a mentor if anyone wants to mentor me, and it's definitely something I'd recommend other people go out and officially find friends who've found mentors really useful. Yeah.
But I suppose on the flip side, you're now doing so much mentorship yourself through the various different advisory roles. Is that is that in recognition of the kind of struggles that you faced, or just intellectual interest?
I think it's more intellectual. I mean, I think I've been lucky I've often had people introduce me to interesting people along the way, or as I said, a lot of roles have kind of been quite organic via warm invites and that sort of thing. So I'm keen to continue to pay that forward. I just enjoy it. I find it intellectually stimulating. Yeah.
We're running out of time now, so I'm going to ask one final question, which is what what's some practical advice that you would give to other clinicians who are looking to explore these kind of alternative careers or have that kind of portfolio career that you have?
Yeah, I've got a few thoughts on this. I think my first piece of advice would be to really think about what you actually want to do. People talk about getting into health tech, but it's such a nebulous. That's like saying I want to go work in the private sector. It's like what? So think about what you actually want to do, how you actually want to spend your days, what types of tasks you like and don't like, what you're good at, because there are so many different kinds of roles in health tech that meet all of those things, non-health tech. So talk to people, reach out to them, talk to them on LinkedIn, get introductions to people, understand how they actually spend their days and their time, and identify the types of activity you like. And then it's very easy to test some of that in kind of a safe way alongside your clinical practice to see if you actually enjoy, you could, be doing quality improvement projects or volunteering. There are lots of ways to test if you actually like that or not. Go and shadow people. It doesn't have to be this big dramatic ship jumping move into the unknown. I think another sort of alongside that is often if you're thinking of changing careers, especially with something like medicine, which is so sort of such a part of your identity, like you're a medical student, then you're a doctor and everyone's very proud. It can feel such a relief to have a sense of direction, or I've picked a type of career and I want to do that. It can feel so relieving that people can rush into that and then end up 5 years down the line thinking, I don't want to do that either. So spend a bit of time trying to understand what it actually is. And a really good careers coach can actually help with that, can help understand some of the practical motivating factors and the things that you are and aren't good at. So get a careers coach, talk to them.
Fair enough. Well, that's some brilliant advice. So that's all the time we have for today. Thank you for joining me, Lucy. And for those listening, if you like what you hear and want to support the show, please do like and subscribe to us on Apple Podcasts, Spotify, YouTube, or whatever podcast platform you are currently listening to us on. It would mean a lot to me, and it would really help us spread the message to others exploring alternative paths. Thanks for joining us, and see you next time. Bye-bye.